Welcome to UNSW COVID-19 question and answer session. I am Madhav Raman, an international student studying Masters in Public Health and Health Management. We are in unusual times, somewhat uncharted territories. As a result of COVID-19, there's a lot of information. Not all of it is true, and this can make some people anxious. To help clarify some of your concerns, we have brought together an expert panel from UNSW to answer your questions. Thank you to everyone who submitted questions. We are unable to answer all the questions, but we hope to cover most of your concerns. I'd like now to introduce the panel. Dr. Bill Kefalis. Dr. Bill is the Director of Health and Wellbeing at UNSW and has been a practicing GP in Australia for 35 years. Next, we have Emily. Emily is a student advisor for the International Experience Unit at UNSW. She is also a trained social worker. And finally, we have Jan Venter, or JH as he's known, is a clinical psychologist and clinical lead at UNSW Counseling and Psychological Services. Thank you and welcome. We have had a number of questions for the panel today, and we'll dive straight into it. Bill, there seems to be a lot of confusion about what the signs and symptoms of the disease are and how it differs from a common cold, and when and where you should seek medical advice. Could you tell us what we should be concerned about and what are the signs and symptoms of COVID-19?
Yes, certainly. Thanks, Madhav, and thanks for asking me along to talk to the students. Look, the signs of a common cold, which everybody's had, I'm sure they know what a common cold feels like. It's usually maybe a mild fever to begin with, and very often there's a runny nose, then a sore throat, maybe a bit of a cough. It's usually a mild illness, although as we know, when us males get it, we call it man flu, but it's usually a mild illness. From the point of view of COVID-19, just from my personal experience on talking to the students that have had the COVID-19 infection at UNSW, I've spoken to all of them, and also from the studies that have been done from very large trials of patients in China and other places. The most common symptoms in COVID-19 are fever, cough, feeling very weak and tired, and aches in the body. They're the most common symptoms, and then shortness of breath or trouble breathing, then maybe sore throat. So things that a lot of people worry about, which we've been asked questions about, like, can you get diarrhea? Can you get a runny nose with it? Yes, you can, but those symptoms of a runny nose and or diarrhea only occur in about 4 to 5% of people. So you can see an immediate difference between a runny nose and COVID-19 will be that the early symptom of COVID-19 would usually be a fever, feeling achy in the body, and a cough, and maybe sore throat, at varying severity. So that's, I think it's got to be very clear to people that there is a difference. There's also a difference with influenza, which is coming. Our flu season's coming. Influenza will tend to, hit you pretty hard fairly early. So usually the first 1 or 2 days, people are laid out with influenza. They're very unwell. Their body's aching. They just barely can get out of bed. They have a high fever and a cough. Whereas COVID-19 tends to build up, and maybe between the 2nd and 4th day, it's at its peak. So it's a slightly different illness. It can linger on for quite a while as well. And of course, it's a new illness, and we're just still learning about it. So I don't want people to think that we know everything about it, just at this moment. It's important to understand that the illness is evolving, and we're learning more and more about it as we go on. The students in UNSW, interestingly, mostly had like the aches and pains and fever, a little bit of a cough, and one of them mostly had a sore throat, but none of them yet have had a runny nose.
Thank you. If we are experiencing these type of symptoms, where should we get tested?
That's a really good question. So I suppose the first answer to that is, it's another question, is should you be tested? So there are still fairly strict guidelines that we are applying to the testing side of COVID-19. So there's 2 criteria that you need to have and to qualify to actually get a test. So the first is what's called the epidemiological criteria, and currently there are two. One is that you have travelled from overseas in the last 14 days, and of course with the current self-quarantine measure, most of those people will be isolating anyway. But obviously there still are a lot of people around that had travelled before that measure came in, and anyone who's travelled in the last 14 days who gets symptoms should get tested. The second criteria epidemiologically is that you've maybe had a contact with someone with a positive COVID-19 infection, and of course since the weekend there's now quite a few students in UNSW who are now contacts of a positive case, and those students should come forward and get tested if they develop those symptoms. The symptoms being, the government's putting out basically I think 4, which is fever, cough, difficulty breathing and sore throat. They're the main symptoms that we would look at, and then you can have a test. The testing can be done at specified COVID-19 clinics, which in this area, there's one at Prince of Wales Hospital on Avoca Street, and there's another one at St Vincent's Hospital. Although clinics themselves can do the testing, and at the health service we're willing to do the testing on students, especially residential students who fit those criteria. We're very strict about those criteria, and we won't test students who don't qualify. Now that may change, of course. Every day the government's coming out with new guidelines, but we'll always follow those public health guidelines.
You mentioned about residential students. We've had a lot of questions from international students who have inquired about when they get tested, do they take their OSHC card, the Overseas Health Cover card, or do they contact their insurance helpline, such as Medibank or Bupa?
Of course they can always contact the helpline. I know certainly Medibank's our preferred provider, and we know that they've got very good advice for people, and also people that can sometimes answer questions in language, and also have access to counselling type help if needed, if the students are very anxious about it. The Medibank card, I think the testing's free, so I don't think there's any need for that, although there is another test that we often do where we're testing for other sorts of viruses that can cause respiratory illness, so it would always be a good idea to bring their overseas health card with them.
You also mentioned about students that have travelled abroad, and a couple of students have asked whether if they have not travelled abroad and have still or been in contact with someone who has tested positive with COVID-19, should they still be self-isolating for 14 days?
Sorry,
students who have not travelled abroad, but they have had interactions with affected individuals with COVID-19. Should they still isolate for 14 days?
Oh, absolutely. So that's a requirement of the public health authorities and part of the contact tracing. And it's a really good point, because it's a very, very important way that we can limit the spread of this illness. And it's often obviously very inconvenient. A student might have been in a seminar room with 30 or 40 students, and they might think, well, I think I know that person. I was on the other side of the room. How could I possibly get it? But for the sake of as a community, the way that we can control this infection as much as we can is to follow these guidelines as strictly, and stay away from the campus for 14 days, because that's the sort of the incubation time that we think is the maximum time that the virus will actually infect someone. Yeah,
Thanks.
That's really important.
Students are also curious to know what type of hand sanitizers or soaps should they use, and also there have been questions about in relation to wearing masks as well.
Yeah.
So maybe you can add something to that.
Okay, thanks. So the way we stop the spread of the disease and the way we stop ourselves getting the disease and the way we stop maybe ourselves transmitting the disease if we're happen to be getting sick is by strictly adhering to hygiene rules. So hand hygiene has to be 60% alcohol plus, most of it 70%. Everything that the university provides that you'll see around is 60 to 70%. I have my personal hand sanitizer hanging off my belt, so I can use it. It's quite portable, and it's a really important part of doing it. So before and after you eat, you should use hand sanitizer. Obviously, before and after you go to the toilet, you should wash your hands thoroughly with soap. For 20 seconds. A hand sanitizer is the same. Your whole hand for 20 seconds, rub till it's dry. And then before and after you might enter a room where you're touching surfaces. So basically you should be doing it all the time when you might be touching things, because you can only get the COVID-19 by either inhaling droplets from someone who's coughed, or by touching a surface that the droplets have landed on and then touching your face. And even while I'm saying touching your face, I can feel myself itching and wanting to touch my face. So it's interesting how often we do it. And I don't know the numbers, but someone's done some studies about it. So that brings me to the mask issue. Sorry, the soap issue is very important because the coronavirus or SARS-CoV-2 has like a fatty layer around it. And of course, as you know, if you're washing plates that have got a bit of fat on them, the soap gets the fat off. So same thing with your hands. If you wash your hands well with soap, then the virus capsule starts to get broken down, and then eventually it dies off once that capsule's broken. So that's why that sort of side of it's important. The mask issue, a lot of people sort of wonder why we don't wear masks as often as we do here. And of course, I think in a lot of countries where they've had a lot of pollution, and then they had the SARS, epidemics and flu pandemic in 2009, and they're sort of used to, it's a cultural thing that they'll wear masks quite a bit, even if they're a little bit unwell. And so I think, I don't think we should make people change their sort of normal practice. But where masks are useful is if you are becoming symptomatic and you happen to be out and about, or you have to go somewhere, you should put a mask on. If you're worried about being in a very crowded place, it doesn't stop you catching it. That's what's important to know. But if you did get it, you'd probably get a smaller dose of the virus, which is part of what we're trying to get people to understand, so that the virus isn't spread as much and people don't get as sick with it. But certainly, for those sorts of situations where you're going to be in a crowded area and you're concerned, there's nothing wrong with wearing a mask. Being unwell and putting a mask on and then coming to university or to work is not a good idea. Yeah.
There have been a number of questions about when the virus is contagious, especially in relation to the positive cases at UNSW. And one student has stated, I've been closely following the news and all the reports. I have read that it is very hard to determine when the patient becomes contagious. Therefore, how can you conclude that the student was not contagious when on campus?
Yeah, look, that's a good question. And, again, I'll go back to the point with, this is a new virus. It's a new infection, and we're learning a lot about it as we go. We still think that the vast majority of people get infected by contacting someone who's got symptoms. But of course, the symptoms can be quite general to begin with. So, just imagine you have a hard run the day before, or you've had a really short sleep that night, and you wake up the next day and you're feeling a bit achy and tired and fatigued. You could easily put that down to what had happened the day before, and then you come into the university, and then that night you get a fever. The next morning you wake up with a cough, and you think, okay, I better, I'm ill. And that's the COVID-19 infection. So who can blame you for coming, to university on that day? So you don't feel that you're symptomatic on that day. Now, the day before you might have been, getting the illness, and we still don't know we think that you possibly could spread it the day before, but it's not the main way that it's spread. It's usually spread when you've got symptoms. So following on from that, Public Health have ruled that when they're doing contact tracing, they're taking the day of the first symptoms, and then 24 hours before that, that's when we consider people are at risk. And so the student in question that question's about, I spoke to that student personally. I got the very intricate details of where they were, and that student really wasn't on campus for 36 hours before they got sick. You know what I mean? So I think that situation is well and truly safe for the students that were in that room. So, but having said that, all we can do is provide the public health advice and sort of follow it. Yeah.
Hopefully that provides an answer to those anxious students out there. One final question, Bill. Is it true that some patients may never fully recover from being infected with COVID-19, especially in relation to lung function?
So about 80% of people who have COVID-19 infection have a mild to moderate infection, and even though they're coughing, they probably don't have significant lung disease, and we expect that they would fully recover. About 16% of people have a more severe infection, and I think a lot of the overseas students would understand that in China it's mainly diagnosed by finding the appearance in the CT scan of changes in the lung, and therefore obviously there's a concern that you may not recover from that. And the vast majority of people would recover from that as well. So I would have to say it's only the small percentage of people who have quite severe infection who recover that may have some problems with lung function. But that's the same with any type of pneumonia lung infection that any person can get. Yeah.
Thanks, Bill.
Thanks.
I'm going to direct this question to Emily. A student has stated, I have a pre-existing chronic illness with a suppressed immune system. Can I take time off class to be safe? And I'm also doing a science degree and need to maintain 80% attendance. How will I go about catching up if I do need to take these measures?
Thank you, Madam. We got a lot of inquiries from students recently. I believe that all students have received update from university on Monday in regard to changes on courses, so including lectures, labs, tutorials and assessments, etc. So my understanding is university has recommended all the lectures go online now, and including lab. So the lab could be online and doing demonstrations for students. Tutorials as well, that if students do need to attend tutorials, they will also get updates from their tutor to see what their options are. So I guess in a way that university is trying to move all those courses, to reduce student coming to campus, and then we're practicing the social distancing as well. So when making sure students reduce the time they come to university, come to campus, but they can still maintain their enrollment and studies online. So I guess to answer that question, if students do feel like they're concerning and they don't want to come to campus, so they can actually doing the studies online. And then also, if you do have any question regarding your assessments, or you worry about how can I participate in the tutorials, student will get updates very soon from your tutor and from your lecturers.
Oh, that's great to know. Another question from an international student, and she states, with no one to look after me here, should I head back to my country? If so, how would I access my course and my exams, and how would all the inconvenience I have affect my course outcomes?
Thank you. So again, if all the courses are gonna moving online, basically students can study the courses anywhere. Okay, so either in Australia or back home to study. Okay, so I think it's a bit of like you can make your personal decision. Like if you think I would like to stay with my family, and also I understand a lot of international students, their parents, they contact us and say they worry about their children. So if you think that's best option for you, you can go home and study. For international students, because of these exceptional circumstances, you can study online, or fully online courses this term. You don't have that restriction that you have to do at least one face-to-face course per term. We have students also returning home and then decide to take a break. We encourage, if you consider this might be a best option for you, you can contact International Student Experience Unit and then talk to International Student Advisor around how we can support you around that. I understand there's a lot of anxiety and then, around students coming from overseas. If students decide to take either leave or student doing only online courses, we will keep the students, international students, COE active. That means that they will not impact on your student visa. So I hope that can relieve some students' anxiety. I understand they're worried if they only study online courses or they're not studying, their visa might have problem. But for this particular term, we will keep the COE open and active.
Well, thank you, Emily, for giving us a detailed answer on that. I hope students will really appreciate it. Currently, our mental health and well-being is going to be a big consideration during periods of self-isolating and distancing. So, JH, I'll bring you in to answer this question. We have had a question from a student who has said, what should I do to keep my mental health and well-being while at home, especially if I'm away from friends and family? And are there any supporting helplines from UNSW regarding mental health well-being during this period of time?
Yeah, I think it can be a very challenging time to suddenly move into complete isolation and cut yourself off, so to speak. But I think we have to think about that time as can we structure it a little bit? Can we make things that we do, that there's things that we do that we enjoy in that time, things that we do if you're not feeling unwell but you're isolating, that you still do enjoyable activity, that you still reach out to people even if it's online, that you try to practice good sleeping, good eating, try to do a bit of moderate exercise even if it's indoors or with avoiding other people doing that. But I think it's a high risk to just try to do nothing, because your mind will run away with you and anxiety will rear its head and it will be quite hard to stay on top of it. So I think it's important to think how you want to structure your day. Do you want to do a bit of studying? Do you want to do a bit of reading? Do you want to look at things you've never had time to do? Maybe you want to explore art. Maybe you want to explore something that you always had an interest in, but you've never really had any time. But now you have time, so you can do those. But I would also encourage people to keep as much contact with others and to figure out who else might be around that is in the same boat, and they can have different contacts. Because I think the thing we underestimate at times of this is if we are compassionate to others and we're kind and caring to them, it does us a world of good, because it's something that people are expecting to do to you because you're isolating. But if you also reach out to others, that can really brighten up your day. You can have systematic contact with people at different spots, try to meet people online, try to be quite productive in doing things you've never done. Maybe read that book you've always wanted to read. Maybe practice a bit of mindfulness. There's a host of apps and things people can use, and just try to think about how to live life where that 2 weeks can be as meaningful as possible without being too concerned. The thing that people dislike the most is that social media can be quite bad for us quite quickly. And I think if you are in a period of isolation, maybe figure out what is a very reliable resource. Tap into that once a day, but try to stay clear of it for quite a bit of the day, because it becomes a bit of a self-defeatist activity to keep checking, because there's always someone putting something out there. It might not always be reliable, it might not always be factual, and there's a lot of scaremongering going on. So I think it's important to pace ourselves, to have a structure to your day, to know when you're going to do what, Just if you can get out for a little bit of moderate exercise, even if you're doing it by yourself, do it. Don't not exercise. Try to keep eating. Try to keep sleeping. Try to keep doing things, and be compassionate to others. Reach out. Be that person you always wanted to be. Be the one that cares for others, and they will care for you. And I think that changes how you feel about being self-isolated, that it's not a form of punishment, but it is something you're doing for your community. You're actually putting a safeguard in to look after people, because we know vast majority of people that self-isolate will be well. And they just need to go through this period of time to make sure that we can curb the infection.
Jade, something interesting that popped up when you answered that question was sleeping habits. What if a student is really getting anxious and can't sleep? Because there seems to be a lot of panic around getting sick and dying. So what strategies would you suggest to cope with this, apart from the already whatever you mentioned?
Yeah, I think people will find it surprising, but I think when you go into sleep, you can't chase sleep down. You can't beat sleep into submission. You almost have to come to you a little bit. So to get that anxiety down right at the start, what we often suggest to people is to do simple breathing exercises where you breathe in for 5, you hold it for 2, and you breathe in for longer than you breathe in. So you breathe out for 7. And you just keep doing that for 2 minutes. And what that will do is it will flip your system into a motion where you can actually feel more at ease, because the panic will drive you to have a systemic heart rate to be quite jittery, and it will be impossible to sleep. So try to count in 5, hold 2, count out 7. Do that for 2 minutes, and then you follow your normal sleeping pattern. Obviously, blue screens aren't great for sleep, so you can't just be doing device and think you're going to fall asleep. You have to lean into sleep. You have to have your pattern and try to stick to it as much as you can, because that last little article you're going to read is probably going to keep you awake, not make you sleep. So sleeping can be quite tricksy, but if you follow that breathing exercise, there's lots of apps, Sleeping Minds, Smiling Minds, Smile. There's lots of free apps people can download. They can listen to maybe 10 minutes before they go to sleep, just to drop away, get your breathing down, have a calm state to go into sleep. Because sleep is our friend even when we're unwell. That's how we recover the most. Is people feel drowsy when they have the flu or they have bugs, and we should try to embrace it. But social media, unfortunately, often chases sleep away, because there's just one more thing we want to read. There might just be one more thing that come up. And we have to really differentiate between what's in our control and what's out of our control. Stuff that's out of our control, we have to spend as little energy as we can on. Things that's within our control, cleaning our hands, wearing a mask, going for a bit of exercise, eating the right food. We should encourage those things. But the things that we don't have any control over, we should try to step a little bit back and just let the anxiety pass by doing those breathing exercises.
Thanks, Jade, for the practical tips. Just to end off today's webinar, I'm going to ask all of you one question. As a healthy young person, COVID doesn't seem very scary to me personally. I can only imagine what it would feel like to more vulnerable people, such as the elderly or people who are living with underlying health conditions. What can we do or say to people who are more likely to be severely affected by COVID, so that they feel more comforted and understood? Bill, would you like to maybe start off?
Thanks, Madav. Look, yeah, it's a really important point, because we know that the elderly are much more, there's unfortunately a higher fatality rate in COVID-19 compared to the flu for those people. And so one of the most important things, I think, is that if you do know people in your family, older people, obviously keep in touch and keep in touch with them, phone them and everything, but it's probably time to start limiting your visiting to them, and certainly do not visit them if you're unwell. And it comes into, I suppose, my final point about, the whole issue about isolation and social distancing, which is what we sort of really have to move into and be mindful that, it's something that we can all do. We can all feel we have some semblance of being able to control part of this epidemic in Australia, and that is by, good hand hygiene, social distancing, and keeping ourselves a little bit more isolated in our day-to-day lives than we normally would do. Thanks.
Thank you, Bill. Emily, would you like to add anything?
Yeah, thank you for that. Interesting, I had a conversation with my family back home. Then they both have health issues, and then they are older, of course. So they do worry what happened, what might happen to them. So I guess what I do is I just have an open conversation with them. I just talk through what their worries and what they think they can do to make their life a lot better. So I think be there is also important too. That they understand that if they need to talk to someone, you're there for them, and you understand what their concerns are. We might sometimes go through some practice around hygiene and things like that. But I guess in a way, because when people are worried, they think about the worst. So I think be there for your family or someone your neighbor, or people in the community. Be there for them and listen to their concerns. That will help them quite a bit.
JH, any final thoughts on?
Yeah, I think it's our time, and it's a little bit of a gift to be compassionate at this time and to really be caring for others. And if it's via online, it's via online. Try not to disappear if someone is asking for you and asking after your well-being. Just reply and get it out there so that they don't build up the anxiety wherever they are if they're looking for you. But if you can, and if you're well, and you can do things for people, even if you don't make contact, if you just go and buy something for them and drop it off, or if you take someone for a walk, or you take their dog for a walk, or whatever you do, I think just go from a point of view where you want to carry your kindness to the community, and they will carry it back to you when you need it. Because I think we can go a long way in a crisis like this to just completely just mind our own bees and not mix with anyone else. If you can mix online, do it. If you can be there, do it. Be kind, be caring, and be compassionate, because there's a lot of people that are quite scared and isolated. If you can go shopping for someone, do it. But follow the guidelines. Don't be silly. If you're unwell, you're unwell. There's no time. It's not a time to take risks. It's not a time to be brave. There's nothing in it. It's a time to be sensible and to help each other.
On that positive note, I'd like to thank all of you for taking out your time to participate in the webinar. And I'd like to thank all the students for contributing to the questions, and I hope the panel have addressed most of your concerns. And like Jade said, coming together in times of need. And stay safe and be well. Thank you.
Thank you.
Thank you.
Thank you.